Welcome to the Cannaman Podcast, hosted by Global Cannabinoid Solutions, the world's leading cannabis science firm and cannabis market entry specialists. We look forward to hearing your thoughts on this latest episode of Cannaman.
Welcome to another episode of the Cannaman Podcast. We've got the wonderful Aleksi Hupli here today, who is a very knowledgeable and passionate academic from Finland. We met a couple of years ago now, Aleksi, at one of the conferences, International Cannabinoid Research Conference in Leiden, and I think it was 2018, I want to say, but since then we've been very good friends, kept in touch, and we've continued to sort of wreak havoc in the world of drugs and cannabis and keep the conversation going. And so, given Aleksi's incredible background, I was really keen for everyone to sort of understand who he is, his perspective, and just for Aleksi to share some of his incredible knowledge on drugs and cannabis and the various perspectives around Europe and around the world as well that are all out there, and how do you make sense of it? And Aleksi is one of those people who's been on the front lines studying drugs of all kinds, and I'm very excited to dig a bit into his background and a few quick notes on what we'll be talking about in this episode. We'll be looking at cognitive enhancement drugs and a bit of Aleksi's work into how drugs at not just a sort of medical level, but also at a sort of social level and at a business level and a sort of productivity level as well. And so we'll be getting a bit of a range of things, not just cannabis and Finnish perspective, but we'll be taking a bit of a higher up view, I guess, or a more of a abstract view of drugs as a whole and the complex conversations there within. So Aleksi, thank you so much for squeezing me into your busy schedule. You've been traveling around Europe, all over the world recently, it seems like, but you've just brought out your book, and I thought maybe that would be a nice topic, because we've both put our book covers behind ourselves just to make the conversation a bit more interesting. But Aleksi, you put a lot of hard work into writing your cannabis guide, and maybe that's a nice place to start, and we'll go a bit into your background and who you are, what you're about, and why you decided to write the book as well. And how does that sound, Aleksi? Do you want to take us for a spin through your? I'm not even going to try and pronounce it. We'll keep going on the lessons, but be great.
Thanks, Chris. Thanks for having me on your podcast. I'm very excited to have this opportunity. And indeed, the book background is called Lääke, Cannabis, Tiedettä ja tosielämän tarinoita, and actually quite nicely links to your book, because I really enjoyed reading the Canna-Manual, especially when I was writing the endocannabinoid system chapter, because you managed to really nicely kind of describe it in a way that it was really made even more sense to me as well after reading that. So it was kind of a nice way of also describing that in our book. The book came out in the spring. It's basically the first book about medical cannabis in the Finnish language. Finland was the first Nordic country / Baltic country to technically legalize medical cannabis, or they didn't legalize medical cannabis, they just sort of through a patient court case realized that they never banned it, but it was kind of became again available in its modern form already 10 years ago, which doesn't mean that patients have great access even after 10 years of this kind of legal access to it. So the book also has a lot of stories from different people that have used cannabis in a medicinal way, not always through official prescription, because it's still very hard to get it. So my co-author, who's a psychiatrist, interviewed a lot of Finnish people about their medical use of cannabis. And so it's kind of mix of these kind of more science chapters, but then also these kind of real life stories kind of mixed in there as well. And it was kind of a great opportunity to kind of, for me as well, to put things in writing that I've learned through doing my PhD and going to the different conferences, indeed the one that we met in Leiden and a few others. So there's all this sort of wealth of knowledge that seemed to be out in the world, but not in really available for in Finnish language at least. So hopefully this will kind of spark some conversation about that as well.
Now, I think it might be worth us digging into some of the content as well, Aleksi. But for those who don't know you so well, maybe also a good time to introduce them to your background and why you've got such a sort of unique view in the spectrum of sort of topics that you sort of covered in your many years of research. And how's that been? What's that like? And could you tell us a bit about the journey as well for people that don't necessarily haven't had that sort of academic experience as well?
Yeah, so my background is mainly in sociology. I just finished my PhD in sociology at the University of Tampere, which focused indeed on smart drug use or cognitive enhancement drug use from users' perspectives. And to kind of maybe rewind a bit, like how I got into this topic and other topics related to drugs. I was over 10 years ago doing my Bachelor of Social Science or Sociology at the University of Helsinki, and I had to choose my bachelor thesis topic. And around that time, this is 2009, there was a government report about whether pregnant women who are diagnosed with substance abuse disorder should be enforced into treatment in order to protect the health of the fetus. And there was some media reporting around that as well. So I was told to choose a topic that seems to be relevant at the time. So I chose that as my bachelor thesis topic. I did a master thesis on that as well when I was in Helsinki. And I mean, the topic was kind of, it's a hard topic. I mean, like how to deal with this kind of issue, which is a thing. But mainly, it's alcohol that's mostly kind of causing a lot of the fetal alcohol syndrome and that kind of stuff. But it's legal, so it's very normal. So during that time, I think the report mentioned that if you're in clinical practice, like if you're pregnant and you say that, yeah, I use wine every once in a while, and doctors are kind of like, well, try to keep it to the minimum or something like that. But if they say that they've even used cannabis, like even before they got pregnant, they would get into these special monitoring programs and such. That was already showing how differently these drugs are handled and approached. And then I was kind of finishing my master's in sociology in Helsinki, but I still wanted to kind of dive more deeply into like health sociology and like that kind of health social sciences. So I found a really nice master's program in Amsterdam in medical anthropology and sociology. So I moved there 2012, and my initial idea was to look at okay, if this is Finland and this is how things are kind of done here, how do they do that in the Netherlands? Like it's known for its more liberal approach, of course. So I was curious to see how they kind of deal with this issue. But I have to admit, like I still don't know, because one of the first lectures that I was in, one of the lecturers mentioned chemical enhancement, and I was like, "What is this thing? Like this sounds pretty interesting." And because the previous topic was kind of hard. I mean, it takes quite a bit of like thinking these kind of difficult, dire situation, and this enhancement sort of seemed like, okay, there's like a positive side to drugs as well, which is not very often discussed, but it's there, of course. Like people don't use anything, I don't think, for the harms that they provide or can provide. They seek some sort of benefit from it. So like this enhancement was like, oh, this is much more positive sort of spin to this thing. So I kind of did my master thesis there, interviewed some students, had a little survey, and then continued on that topic in my PhD, which took 7 years to make. So there's all kinds of articles in my book, which is openly available online. We'll probably provide the link. And so there's a few articles based on that interview or master thesis data that I collected. But then there's also a medical cannabis case study there. There's one article kind of comparing Finland and the Netherlands in terms of stimulant use, and I was trying to see what's the evidence for this specifically cognitive enhancement use, especially among young people. And there's some studies from the Netherlands, but not really anything from Finland. So it was like, okay, there's a lack of evidence showing whether this is happening in Finland or not. And there's not much out there. But there was also like one study looking at psychedelic microdosing on YouTube videos. So it was a bit of a mixed method kind of thing, looking at different aspects of this topic, and then writing the whole summary article, which became quite extensive as well. It was kind of challenging in order to kind of make this some sort of coherent whole. But I managed to do it, at least to the degree that I got my degree. So I mean, that was
congratulations as well. While you were doing that research, Aleksi, like what sort of facts were you finding? Because it obviously, I guess there's quite a range of uses and a range of purposes that people might be using drugs, and a range of drugs as well that people might be using. What were some of the trends that you saw, and some of the most interesting sort of like data points that you found that were quite impactful, or maybe that stood out to you, that people should be aware of?
Yeah, I mean, the literature around this, it's been really discussed in the fields of like bioethics and neuroethics and this kind of transhumanistic literature. And they really focused on like prescription stimulants, dextroamphetamine or Adderall or methylphenidate, and kind of other generic forms of these kind of prescription stimulants that are mainly used to treat ADHD, or attention deficit hyperactivity disorder. Our interview studies with the students who were based both in the Netherlands and Lithuania, surprise, surprise, found that students use other drugs as well, not just prescription stimulants, but, you know, just your average street stimulants like amphetamine, methamphetamine, cocaine, but also cannabis, also psychedelics. So it was kind of like, at least in real life, you know, the spectrum of drugs that young people use for this kind of enhancement is a bit wider than usually discussed in literature. I mean, that literature has now picked up a bit, and there's other research kind of showing this as well. And I mean, at least the bioethics literature quite often kind of, because, you know, even the term enhancement drug use kind of, you know, it's in the word that it is used for enhancement, or it does enhance, which is still kind of debatable whether it does that or not. I mean, I think a lot of the students that we interviewed, they were maybe, you know, a bit late on starting to read for their exams or something. So the last few nights, they kind of stayed awake with stimulants and tried to study with that. So like whether that actually translates into better performance or better, you know, study results, that's, I mean, we didn't really have a chance to look into that much in the interviews, but that's also kind of like whether they actually do enhance. There's a bit of like debate still, like whether that is the case or not, but there's a bit of assumption in the name already that they do.
Yeah. Did you find it difficult to recruit for that study? Because I imagine again, I don't know what the context or the social perspective is on drugs in Finland and Scandinavia particularly. I tend to think, well, knowing how alcohol is regulated, it could be quite conservative, but I personally don't know, and I imagine a lot of the viewers don't know. But for, starting that conversation even, and just recruiting people for that, I imagine that was quite that's pretty out there and a pretty ballsy like study to go for, and something like a very powerful question, but very difficult to study. And again, going back to bioethics, like how did you deal with that? Did you get resistance around some of this? It's quite a taboo topic, maybe, no? How was that?
Well, luckily I was indeed doing my fieldwork in Amsterdam, so that was not really much of a problem. And I was, you know, as a student myself, I was living in a student accommodation with, like, I had 16 housemates. There was a little secret bar in the basement as well, so I was bartending, and, you know, it was easy to kind of bring the topic as well. And in the published articles, there was like 3 other students at the same time doing similar interviews, one based in Amsterdam, one in Lithuania. And then through this project called Chemical Youth, which was this quite large ethnographic study in different parts of the world about how youth use chemicals in general. And so we had a little workshop where we, shared our own interview findings and then compared with the others and then kind of combined those. So we had like a fairly extensive interview data to look into. So, but in terms of recruitment, I mean, it wasn't, at least in Amsterdam, wasn't difficult. I think indeed, like in Finland, I would maybe find it a bit more difficult to do. And there's like few anecdotal, like journalistic reports where they ask students like, hey, have you heard of this? Have you done this? And most are like, no, I have no idea what you're talking about. Like I drink coffee, which is also, can be enhancing. So it's hard to say whether this is happening in Finland or how difficult it would be to find people to talk to about this. I would imagine, it's a bit speculative, but with COVID and like a lot of online teaching and all that, like our cognition is really on, like it's putting a lot of demand on our cognition. So I would guess that students might have during this time tried to reach out to different kinds of methods to make sure that they can just follow, hours on end on a day, which hard to say whether it's happening or not, whether it's happening more now, but like also like, in terms of like harm reduction, because I mean, some of these, even like prescription stimulants can be quite powerful and that was the other finding that we found, because the bioethics literature really like depicts this kind of in a positive way, that we also, the students did report so-called side effects or adverse effects, or not really effects at all. So it is sort of it's good to be critical about these things as well, and not just because the name says cognitive enhancement doesn't mean that it really necessarily does that, or it might do that, but you have to kind of balance the harms and the benefits with it.
For for a lot of these drugs, is the use quite common amongst students? Is it an international phenomenon, or is there much documentation of that in literature as well? Because I imagine there is quite rampant drug use, having seen the student way of life, and how well is that sort of monitored in the academic world?
Well, there's been prevalence studies, but then again, like it really depends, like how do you first define like what is the drug that you're looking at. So if you look only at prescription stimulant used for this specific purpose, then the prevalence is going to be something else if you broaden the kind of spectrum of drugs that people might use for this. I'd say in general, European studies have shown a lot lower rates than compared to, for instance, in the United States. But of course, there's a lot of things that can explain that. I mean, the US is, you would say, more competitive. Even the prescription culture is very different. Like the prescriptions are maybe easier to get as well. But like even there, like the prevalence varies from like 5% to 55% into like fraternity members in certain really high demand universities. So there's, depending on, I'd say, like on location as well, like it does sort of make a difference. And I think sometimes there's maybe kind of this I don't know how you describe it, like indeed, like people think that everybody's probably doing this around me, because I've talked to a few people and they say they do it. So really depends how you define the issue, but for instance, if you include coffee, then I would say 90% of students are using some form of cognitive enhancement. But if you go into like, okay, how many are using a prescription stimulants without actually a prescription for it, I think that the numbers will go down quite a bit. So I mean, I'd say in Europe, really depending on the country, it's still 5% around that. So it's not like everybody's doing it, but I don't know if that's changed through this kind of online teaching through the pandemic.
So given this sort of phenomena, what sort of harm reduction measures are being implemented? And I know you've had a pretty strong involvement in looking at ways that it could be managed and overseen. And what are some of the approaches that you've seen taken, and moving into the future, like what sort of interventions might we see and approaches to drug use and harm reduction as well? Like, what are your sort of views on that?
I don't have any like concrete programs to mention, but I mean, like I think like just honest discussion about both the potential benefits and potential risks would be one way to like go around with this, and like asking students who are, I think there was a study from Finland saying like, I think 1/3 or 1/4 of university students are dealing with some sort of mental health issue. So there's definitely like, people needing support, and if they don't get other kinds of support, they might indeed then start relying on drug use, which is, I'm not saying that it's necessarily a bad thing if it does helpful, but they come with risks, of course. So like having that kind of open discussion and conversation about both the benefits and the risks around this, and like whether the society is really pushing people to do this as well, because I mean, like, we need to be productive and do everything faster and better, and like that's sort of, there is this sort of societal pressure on this as well. So but the fact remains still that using most of these drugs remains illegal as well. So there's that risk as well, which is also not really often discussed in the sort of cognitive enhancement literature, in terms of like, that is also a big risk that people are willing to take, or some people are willing to take when they use these things.
So now that you've sort of trodden the journey of academia, and you've been through the years of PhD work, like what sort of lessons have you learned as well about sort of academia and research, and that sort of postgraduate life? Like I mentioned earlier on that we get quite a lot of students that are interested in knowing more about sort of drug academia and getting involved in the world. And so, are there things that you've learned along the way, or guidance or recommendations as well, that you might even have for young researchers that want to get involved in drugs and cannabis research? It's obviously becoming quite a lot more open, and it's something that can be quite well researched now. So are there any, how do you feel about it? Are you traumatized? Have you enjoyed it? Or where you're up to emotionally with it now as well?
Well, I'm happy that it's done. I'm happy it's finished. It took maybe longer than I originally expected, partly also because of the realities of academia. Like of the 7 years that I did my PhD, half of those years were funded by some sort of scholarship that I managed to get. I'm not saying that my kind of percentage of like sending funding applications and actually getting them is very high, but luckily I managed to get a few of them. I think what one needs most is perseverance. Just kind of like it's not a sprint, it's a marathon. And academia, and for instance, publishing academically, it's a long journey sometimes. I think one of my articles took like 3 years to get it published, and you have to be able to receive critique. Of course, that's part of it. Like if you send it for peer review, they're not there to be your friends. They're there to like make sure that the quality is good enough so that you can get pretty not nasty comments, but like you work really hard on something, you think like, oh, this is great, but then the feedback might be something quite else.
A little harsh.
Yeah, sometimes. But also, like, I mean, I've been on the other side as well. Like I did, I was an editor for one special issue for drugs and alcohol today. So like also, finding good reviewers is difficult, and this whole academic publishing world is also kind of weird because nobody really gets paid for doing this, reviewing or submitting your work. So it is kind of strange world in a way, because you have to rely on people doing this on their own free time sometimes, and you hope that they still put the effort to kind of provide you with good comments. But I mean, it's not, I don't think it's, if people think, oh, I wonder if I'm smart enough to be a PhD. I mean, if you manage to get into university, you're probably smart enough. So it's like, it's not just about your intelligence necessarily. It's like perseverance and just, sticking with it. I mean, I was lucky, in a way that it was really my own PhD project that I could, if I wanted to, like, okay, this is now an area that I want to look into more, and so I could. So it wasn't something that was told to me like, okay, now these are the tasks that you need to do. So I was in a way lucky that I can do my own project that was really like, it was interesting. So it was like, it was in that way easy to keep with as well.
If it's something you're passionate about, it's a lot easier now.
Exactly.
And yeah, I couldn't imagine that if you didn't enjoy what you were doing, you'd have done it for 7 years and stuck with it. So great piece of advice, Aleksi. Thank you.
I mean, what happens now? I mean, yeah, now I haven't graduated now, so like it would make sense to continue in academia, and I am working on a small project now, mostly about wine, actually. And then looking at what's out there, but also like, I mean, of course, there's research that could be done indeed outside of academia as well. And I mean, these drugs, most of them are indeed becoming at least medicalized in a way that there's more research into the medical properties, and there's psychedelic companies listed in the stock markets and all that kind of stuff that wasn't there 10 years ago. So I think there's a lot more opportunities as well if you want to research or somehow being part of this this field. And it doesn't really matter like what's your background or what's your discipline. I think you can approach these things from every kind of imaginable academic discipline, from history to psychology to medicine to neuroscience to anything basically.
I guess that brings us nicely on to sort of where you think the future is going for drug policy and just, I guess, the Western approach to drugs. Like, how would you describe the trend at the moment, and where do you maybe see that trend heading over the next 5 to 10 years?
Yeah, I mean, just recently Malta becoming the first European country to legalize cannabis in certain form. And, I just saw a news that, there was somewhere in university in Texas having a psychedelic research center, and like all these kinds of news that seemed to be like unimaginable a few years ago. And Germany now also having plans for legal adult use for cannabis. So it's quite exciting times in a way. I mean, of course, with all these, there's pros and cons. For instance, like this whole medicalization of these substances or pharmaceuticalization as well, like it might indeed lead into more research and one day them being available for patients in need. But like what is the actual route of access? Like, is it only going to be available with people that already have the means and the resources to go into a private clinic? Or, well, I guess the case with medical cannabis in the UK is a good one. Like, even if on paper something is legal, doesn't mean that you have access to it necessarily, at least through public health channels. And I mean, who's there indeed kind of benefiting from it as well? Is it the harm reduction and the other activists that have been working for decades to kind of make this change, or is it the kind of more boardroom executives that are kind of pumping money into the already kind of loaded stock market? So like, these are things that we need to also kind of look at as well. So like, even though I think the change in general is good, that there's more countries now willing to kind of leave this whole war on drugs kind of approach that they've been trying for the last 50 years at least, and to kind of have other strategies. But with any kind of policy, there's intended consequences and unintended consequences as well. So we need to kind of keep an eye on both of those as well. I mean, I'm hopeful. I guess. I mean, I don't think I could be doing this for so long if I didn't see that there's some sort of light at the end of the tunnel. Hopefully as well. But there's still, of course, a lot of work to be done, because I mean, at the same time, when there's people making millions on the stock market, there's people in prisons as well for the next decades, that they've been there for a long time. So there needs to be, like, if there's some sort of reform, this has to be also social justice kind of really grind into that as well, to make sure that the wrongs of the past are also corrected.
Would you mind touching a bit more or expanding on some of that social justice side? Because I don't, again, for those in the newly emerging cannabis industry, they're maybe not quite as aware of some of these issues and other just injustices, I suppose. And so, what particular areas do you think people should be aware of?
Well, I think, for instance, when California legalized adult use of cannabis in 2016, I think that reform had pretty good sort of social justice aspect to it, like not just sort of giving people and businesses the opportunity to have a legal business with it, but also try to make the past wrongs in terms of, like, releasing people that were in prison for instance, selling a joint. I mean, and like some of those sentences were not pretty harsh, but really harsh. Like, you can get, like, I don't know, 20 years for a joint or something. So, like, if we are going to legalized form, we need to somehow make sure that that the people that are still facing the consequences of the war on drugs are also somehow, I don't know, maybe not compensated, but at least that their lives are also improved while new people coming to this emerging kind of business world. And also, I mean, the benefits of a legal business that there's tax revenue that can be used for all kinds of other programs for giving treatments or harm reduction advice and all that kind of stuff. Because I mean, like, there's usually like a bit of a assumption that if something becomes legal, that the use will also rise while that happens, which could be the case. But I mean, I don't see that that's a problem per se if that rise is controlled, and there's treatment opportunities for those people that might have or develop a more problematic relationship with cannabis, for instance, as well, which is not a large amount of people usually, but still it is there. So, like, we need to make sure that if there's, for instance, the government gets tax revenue that is funneled into, for instance, programs in terms of treatment, so it's easily available and that. But also make sure that if there's a population that was doing kind of what the legal businesses are doing, that they don't need to face another decade in prison just because now our perception of these things have changed. So we need to kind of also have this kind of social justice aspect when we're doing legalization. And I mean, who knows? I mean, it's still early to say in terms of like Europe, how these kind of new reforms are going to really take place. I mean, I haven't really looked into too closely. I know in Malta, like, they didn't really go to the commercial route at all. Like, it's like you're allowed to grow your own, or maybe have like associations or clubs that you do it collectively, but there's no similar kind of structure that they have in the States. Like, there's like a really like big kind of legal market where sometimes big business comes and takes over. I mean, there's a nice graph called the drug policy spectrum, so which shows like there's harms on the prohibition end, but there's also harms if you go like fully legal, capitalistic, promoting its use for everybody. So like there's harms on both spectrums. So trying to find that somehow sort of like a middle ground in these. So like it's not fully prohibited, but like there's still restrictions of like, can you advertise it or, you know, have used, you know, kind of products that are appealing to young people or something like that. So like there's, and I do think that legal regulation with any substance is the way to go, but that can be done, you know, in a good way or in a bad way as well. So it needs to be kind of a balanced kind of view.
Mm-hmm. Well, I think the trouble that a lot of people hit, or I guess the wall that a lot of people hit when you talk about drugs and the consumption of drugs is, oh, well, it's illegal. And we don't really get into, well, why are people using those drugs? Yes, like, again, okay, it's illegal, but people are still using drugs and there's still a massive international black market around it. And so what's going on there? And are there other ways that we can approach that rather than going, oh yeah, it's illegal, so we're dealing with it and it's a police problem, when at the moment it clearly doesn't seem to be working. So it's quite clear that a trend's emerging, and it's interesting that Malta's decided to sort of go the opposite way to the UK, for example, where we've tried to create a commercial side to it, which hasn't really, I wouldn't say has really worked in the best interests of many people. It's been pretty unproductive and it's still sort of stifled at the moment. So for Malta to go, oh, well, look, actually, just grow it yourself and be self-sufficient and we don't really want too much to do with it. That's quite such a polar shift, I suppose, and a completely different viewpoint, which fundamentally seems quite rational. But again, I wonder what it would maybe take for a similar approach in the UK and just why they've come to different conclusions. So I suppose the research is the same, no, internationally. It's just interesting how different governments approach that research and interpret it and go and implement it into their systems as well. So that's a very fine point, Aleksi. I'll have to put up a image of the drug policy spectrum up in there. So this is a bit of a note to self, but it's just difficult to visualize a lot of this as well. And so like what we're talking about is quite abstract and sort of in this thought cloud up here. So how do you like make that more tangible for people and visible? So I'll have to put that up as an image, and maybe there's a couple of other ways that we can try and help people visualize this. And just on that note, Aleksi, like how have you tried, like for your PhD, what tools have you used, I guess, to sort of communicate a lot of this? Obviously there's writing, isn't there? And you can have, well, endless black and white text, but how have you found is best to communicate some of these topics and some of these findings as well? Because it's an incredibly complex conversation, and all of these nuances. What's your approach to helping people have that understand?
Well, I don't know if it's common or not, but I mean, like I got quite a bit of media exposure. One of my PhD came out in Finland from like the government national media, and I got into like a Friday night TV debate with the Christian party leader about drugs as well, which was interesting experience. I think I was more nervous about that than my actual PhD defense, because a bit more viewers at that end. And I managed to kind of give a few of my thoughts across, but I think the Christian party leader was actually a medical doctor, but it wasn't very Christian in terms of like how he thought about drug users or drug use, and not very health perspective kind of either from a medical doctor, unfortunately. So like in Finland, like even like having a discussion about this topic is quite a challenge, because indeed people quite often, it's legal, so it's legal, illegal. So I mean, like there's not really like how to go beyond that. Like, okay, yeah, it's illegal, but people still do it. So how can we reduce the harm of that? So it's difficult to kind of get that even discussion going. There's luckily we managed to get a decriminalization initiative in Finland a couple of years back, which if you get 50,000 signatures, the parliament has to at least debate about or look into the discussion or topic. So there was a proposal to decriminalize adult use of cannabis, which also would allow floor plans for homegrown as well. So it's still kind of in the process of in the parliamentary law committee. I was a bit proactive on that, and I approached them, and I was officially asked to send like an expert statement, which I mean, hard to say what the impact of that will be, but I tried to use that opportunity to at least kind of give some education to the lawmakers of like what's the endocannabinoid system, for instance. Like I don't think people I mean, for us, like, I mean, these things are kind of, a bit more self-evident in a way, but I don't think people even know that. I mean, even doctors don't necessarily have even heard of endocannabinoid system.
Yeah.
So like, I would really like to somehow be part of like giving indeed information and education. I mean, we did write a small piece to the Finnish Medical Journal with a few other writers as well, because like even the medical cannabis discussion has been very one voiced. So there's like been one professor of pain in Helsinki who's been commenting on this for the past 20 years, and her comments are very, there's not enough evidence, there's all these risks, which she usually confuses with like the risk of like recreational cannabis. So like it's been really hard to kind of get doctors more involved and like finding them for themselves, like what is the literature, what is the sort of evidence for this. And I mean, of course we have to admit, like there's not too many phase 3 controlled clinical trials on a specific indication, but also that's partly because that kind of thing is expensive, and cannabis is quite peculiar in a way. Like it has such rich molecule package, so it's not just one molecule for one indication, like it's all these molecules that seem to work for a variety of conditions. So it is kind of different in that way, of course. And although I'm very I'm enthusiastic about, for instance, psychedelic research that's really showing great results in terms of like all kinds of mental health conditions, I think medical cannabis is something that I would like to focus more on, because it's already there, it's available. Every doctor in Finland can prescribe medical cannabis if they choose to. The unfortunate thing is that they choose not to. They say that there's no national guidelines for this, which is true. Well, I mean, doesn't mean that your clinical experience doesn't matter if you can look at the literature and like if the patient says like, this really works, like I've tried everything else, they don't work, this works. And like there's lack of trust among doctors towards patients, but also lack of trust among government officials towards doctors. For instance, there was basically in the last 10 years where medical cannabis has been available in Finland, there's been roughly 300 prescriptions. Some of them for multiple, few prescriptions from one patient. So like the patient population is quite small. This summer, there was news stories that basically the one doctor, a neurologist, who was responsible for about half of those prescriptions, was approached by basically the government kind of body that monitors what doctors do, and they forbid him to prescribe medical cannabis anymore. It was very specific, like you can prescribe other things, but you cannot prescribe this, which means that half of the medical cannabis patients in Finland are now struggling because they don't know how to renew their prescription, because they have to renew it every year because the special permit of the of the because it's a drug prescription. And it's kind of hard to like, okay, what to do with this? I mean, like, you cannot force doctors to prescribe. I mean, that's not really how this works. So what could be done in terms of like trying to at least get the patients that have their prescription and have seems to be that it works for them, at least how to like at least kind of maintain their medication use in terms of this. So, and I mean, unless doctors really get involved somehow, or if there's sometimes you kind of get like, I don't know what to do. I mean, I wrote a book, I've tried to have a conversation, but like it still seems like it's not enough. And of course it's for people that are really struggling with their whatever condition that they have. I mean, there's been hopefully not actual stories, but like some patients have said like, okay, if I don't get my prescription renewed, then that's it, I don't want to live with this pain either. So like they're faced with an impossible choice as well, either become criminals or just end it all. So it's
similar struggles over here, Aleksi. It's not definitely not a perfect system, and again, a lot of people, like, although there is now a very legal, like there is a legal paradigm that can be accessed, it is incredibly inaccessible to the majority of people, and far from a practical solution for the vast majority. It's ticked a very small box, and I guess it's maybe a chink in the armor, but at the same time, it's not for those patients that are sort of sat there in agony or potentially having seizures because they're not getting their medicine or prescription. It's like, it's not really enough. And I think maybe what doesn't really get looked at enough, and same goes for all the industry and the business as well. As wonderful as it is, there's more that could be done by our industry, I think, and by the cannabis industry to be able to support patients in that position and raise more awareness for that issue, and that sort of dead end that we're putting all of these vulnerable people in. And again, like, what horrible, you're already in pain and already distressed, and we're only causing sort of further harm by having this sort of very, very narrow perspective of cannabis, but drugs as a whole as well, and the benefits that people like. The potential upside is incredible, but then we're so focused on this very minute, these tiny risks, it can't be done. We're very much limiting ourselves, and again, the science and the research around it as well. It's not just the consumption and the safety of it, but if it makes it even more difficult to research it, then like it's fixed, and what are you meant to do? And so it needs to be, I don't know, for me anyway, Aleksi, it seems like all we can do is put more of this information out there, write these books and do these talks and guides, and try and raise more awareness for the science of cannabis and the endocannabinoid system, and just all the academic knowledge that's out there, making that more accessible to people. So it's really wonderful that you've conquered Finland in that sense, and given them a navigation point, and it obviously it's going to be I think for us both, it's going to be another one of those long, passionate journeys of getting there in the end, marathon, not a sprint. And it's not again, it's not ideal, but there's only so much like you or I can do, and that viewers can do of this. But the more this information gets out there, the more these conversations happen, the sooner we're going to be able to start progressing some of this and stopping it. It's inhumane, really. I can't believe it's happening in the 21st century that we're still cutting off people's medicine for bureaucracy. Now, like, surely that's more dangerous to cut off someone's like proven medical benefit and cut it off than it is to let them continue taking it. And lots of contradictions, I guess, lots of misinformation, lots of fear and confusion, and
I mean, it shows how effective the war on drugs propaganda has been. I mean, like, and especially if you think of like the older generation that was kind of in the middle of it. So I mean, like it's important to also kind of be, I guess, understanding that, you know, they were really fed, like, you know, it's dangerous, and like if you even come closer, you're probably gonna go crazy or something like that. So like it's just, I mean, there's gonna be a generational change eventually, but of course that's gonna take some time. I mean, most, you know, youth parties in Finland, for instance, they were really supportive of the decriminalization initiative. The Green Party even now has in their party program more broader cannabis reform, which is also kind of like by their more youthful members of the party managed to kind of get through. So like the change will happen, but of course there's patience in need now. So like for them, it's kind of like, okay, we can't wait for, even like, you know, if the Finnish government all of a sudden like, okay, we're going to start a medical cannabis research program, we're going to do the best RCTs, yeah, but that's going to take 10 years before that's really going to become a thing. So,
and until then, everyone's a criminal, or they need to go through the very strict system. And so it's just impractical, like just embarrassing, really, that that's the stance that we've taken as a developed nation and as a continent, really. But I hope that we can connect more researchers and get more of these perspectives out there. And if there's other people as well, Aleksi, that you think I should be interviewing, let me know as well. And again, for viewers, if there's people that you'd like me to interview, like that's the goal.
I might have a few names for you.
Yeah, great. Well, that's like, just more of this is great. And just trying to put, like, again, science isn't always the most exciting, is it, Aleksi? And especially when you're reading lots of papers in academic journals, like that puts a lot of people off. And so a lot of this information, people's go, oh, I haven't got time. But if we can make these things more interesting and more accessible, and I think you've got, like, from the conversation we've had, you've probably got most of the key bits of information from both books in this conversation, I think. So it's, a step in the right direction, I suppose, eh? It's what we're doing, what we can, Aleksi, but these things take time and money as well, which is very useful in this day and age to influence things. But for now, I think we've covered just about everything that we needed to in a pretty succinct amount of time there, Aleksi. I really appreciate you talking everyone through your years of work and all of the incredible learnings that you've gained over your many years of research and hard work. And I want to as well recognize Aleksi's passion for this subject area as well. Like, there's no, like he was saying, a lot of this gets done out of goodwill. A lot of it gets done for free. Funding for these projects isn't massive. And this whole area of research historically has been something for lunatics to assess. And it's always been that sort of fringe area of research and science. And so without passionate people such as yourself, Aleksi, a lot of this wouldn't be moving forward. And so, there's loads of researchers out there, but Aleksi, thank you for all of your hard work and all of your passion and energy for doing what you do. And hopefully we can pull together a larger community of fellow researchers and just have a bit more of a community conversation, because it's quite isolating as well now to be doing all of this in on your own. And appreciate, and again, really lovely to keep in touch with friends like Aleksi, and know that you're not crazy doing researching these things, and there are other sane people out there as well who you can have a conversation about this stuff with.
But be aware, it is addictive. Like, drug policy and drug research can be addictive.
Should come with a warning as well, not just the molecules themselves, but the information and the knowledge around them. So very, very good point. And I think we'd both recommend it to anyone to sort of research this area more. And if you are interested in more cannabis information, we've always got lots of freebie free educational materials and tools and things like that on our websites. And Aleksi as well, I don't know if you have any sources if people are looking for more information. Where can people download your book as well?
And the PhD is basically at the Tampere University depository. The title is Smarter with Drugs, ? Sociology of Cognitive Enhancement Drugs from Users' Perspectives. And if you type that or my name, it will probably come in your Google search and it's there. The book, if there's any Finnish viewers, of course, the publishers Basam Books has it on their website, but it's apparently also in bookstores all around Finland.
Very cool.
Nowadays. And libraries as well, which is cool as well.
Very cool. Well, we'll have to get the links in the descriptions for everyone, and so people can click through and see more about you. But thank you so much, Aleksi, and thank you for showing me how to put these backgrounds on as well. This has been a test background, but I thought, looks quite funny, and I thought it'd be nice to get our books up and make it a bit more colorful. So lovely to see you, Aleksi. Thank you so much.
You too.
We'll speak to you very soon, and really appreciate all of your time, mate. And I don't know, any final messages for viewers that we've missed? Or
if you're interested in these topics, I do, I'm pretty active on Twitter on my own name, but also have like a YouTube channel and Instagram called Drug Ventures, which is like I've been documenting all kinds of drug related topics, which is something I kind of want to get into more. The PhD was kind of time consuming, but I have like 4 terabytes of video material from the last 5 years. So I kind of want to start doing something with that as well. But there's already quite a bit of material on YouTube as well.
Oh, well, we'll put some links in there as well for the Drug Ventures, and we didn't even get onto that yet, Aleksi. So there's probably, I think, another podcast in the books. And when your next book comes out as well, Aleksi, we'll have you on too. But we'll do another one very soon. And thank you again for entertaining us. And really appreciate all of your time, Aleksi, and all of your hard work. So thank you so much.
Thank you. Take care.
We hope you have enjoyed this episode of the Cannaman Podcast. For more information on how you can safely navigate the cannabis ecosystem, take a look at some of our educational materials or reach out to us at www.globalcannabinoidsolutions.com. We look forward to you joining us on the next episode of the Cannaman Podcast.